Hey all, welcome to Share Trek. This is Raj here. I have seen frantic messages from time to time from people scared of infection. Today I want to give you information about testing for HIV. But I strongly recommend that if you doubt that you are exposed to HIV, go straight to your doctor who is qualified to handle these situations. That said, let's get started. Welcome back. First, let's look at the transmission routes. So, unprotected sexual contact, sharing needles, mother to child transmission consisting of transmission during childbirth, breastfeeding, or pregnancy if the mother is HIV positive. Rare cases of receiving contaminated blood or organs from a HIV positive donor. Transmission risk during pregnancy if virus enters the mother's bloodstream. Very rare transmission by sharing personal items like razors or toothbrushes with potential blood exposure. And sometimes occupational exposure, healthcare workers may be at risk through accidental needle sticks or other exposures. Now let's talk about choosing the right HIV test, what a doctor's decision making process is likely to be. When it comes to HIV testing, healthcare professionals carefully consider various factors to determine the most appropriate test for each individual. The decision making process involves assessing the individual's risk factors, the time since potential exposure, and the characteristics of different tests that are available. Doctors first conduct a thorough risk assessment considering factors such as sexual history, drug use, and the potential exposure to infected blood. High risk situations may prompt the use of more sensitive tests or multiple tests to ensure accuracy. A term window period is frequently used. The window period is the time between HIV infection and the detection of antibodies or antigens. This influences the choice of tests. Nucleic acid tests, NAT, are highly sensitive and suitable for early detection during the window period. Let's talk type of test. Doctors may choose antibody tests like ELISA, ELISA, and Western blot for routine screening, especially when the individual is not in the early stages of infection. Or they may choose antigen tests such as P24 antigen test, which is valuable for early detection. We have combination tests, generally referred to as fourth generation tests, that combine antibody and antigen detection, are commonly used as they shorten the window period and offer a much more reliable result. Then there is also the matter of patient preference. Factors like patient's preference for testing method like blood, oral fluid, or rapid test, and the need for confidentiality may influence the choice of tests. Is there an impact of HIV strain on testing? Well, HIV is classified into two main types, HIV-1 and HIV-2. While HIV-1 is more prevalent globally, HIV-2 is found mainly in West Africa. The strain of HIV can influence the choice of tests in the following ways. First aspect is test sensitivity. Some tests are designed to test both HIV-1 and HIV-2, ensuring broad sensitivity. Then we have geographical considerations. In region where HIV-2 is more prevalent, doctors may consider specific tests that are effective in detecting HIV-2 strain. We also have global standards. Many modern tests are designed to detect both HIV-1 and HIV-2, aligning the global testing standards. We also have combination tests. If initial test indicates HIV-2, confirmation through specialized testing may be recommended. And in summary, doctors tailor their approach based on individual risk factors, the testing window period, and special consideration related to HIV strain. Modern testing options often provide comprehensive coverage addressing HIV-1 and HIV-2. It's crucial for healthcare professionals to stay informed about evolving testing technologies and global HIV trends. Before we proceed further, I want to emphasize that you need to contact your healthcare provider as soon as possible if you suspect infection. Internet sources may not be reliable in helping you in this aspect, including this video. Now, let's talk about the type of tests. Firstly, we have antibody test, ELISA, or enzyme-linked immunosorbent assay. This is commonly used initial screening test, which detects HIV antibodies. If positive, it is usually followed by a confirmatory test. Then we have the Western blot. This is a confirmatory test used to verify ELI assay results. Detects specific HIV antibodies, helps reduce the chance of false positives. Next, we also have antigen tests. P24 antigen test identifies the P24 protein of the HIV virus. It is particularly useful for early detection, often used in combination with antibody tests. We also have so-called fourth generation tests. These are combination tests for detection of HIV antibodies and antigen. It shortens the window period for accurate detection. We have the nucleic acid test or NAT. First of these types of test is the PCR or polymerase chain reaction test. This test amplifies and detects the genetic material of the virus. It's very sensitive and can detect HIV earlier than antibody tests. Often it is used in early diagnosis or in high risk situations. There are some home testing kits. OraQuick in-home HIV test kit is one of them. This test involves swabbing the gums for oral fluid, provides result in about 20 minutes, confidential and convenient. Next, we have home access HIV-1 test system. This involves collecting a blood sample at home, which is then sent to a lab for testing. Lab then provides the result over the phone. Another category of tests is the rapid test. First of these is the INSTI HIV1/HIV2 antibody test. This is a rapid finger prick blood test. It provides results in about a minute with high sensitivity and specificity. Allier determine HIV1/2 AG/AB combo is another test. This test detects both HIV antibodies and antigens, gives result in 20 minutes, suitable for various testing environments. Please remember that you cannot rely on internet sources for HIV. You need to contact your healthcare provider or doctor if you suspect you have been exposed to HIV. The sooner you contact them, the more they will be able to help you. Let me remind you that I am not a doctor. So if you have questions about these tests which I have explained, please contact your doctor. They will be able to tell you absolutely the latest information. Hope you liked this video. I'll be back with the next video very soon. Bye for now.